So one of the reforms we propose, because we are pro-reform, we're not saying we don't want this bill because we don't want anything to change. The problem is there is too much government intervention in the healthcare marketplace. They're not allowing consumers to make the decisions for themselves. If we allowed consumers to purchase health insurance across state lines, that would create a really competitive marketplace where people from New Jersey would probably purchase their insurance in Pennsylvania. People in Minnesota would purchase their insurance from Arkansas, where it's much less expensive and where mandated benefits are numbering in the 40s or 50s. If you have any more questions about that, let me know, and thanks for having me.
We have the Associate Director of AARP, Bottorff. Bruce?
Thank you, Councilmember Djou. One of the confusing points about what's currently going on in Congress is that there is no single plan. There are actually 5 separate plans or bills, 3 in the House that has come out and has become popularly known now as the tripod bill, and there are 2 in the Senate. We're still awaiting the details of the very important Senate Finance Committee bill, which in a sense will dictate a lot of the cost and payment issues that we're waiting to address. These have yet to be reconciled. When our members of Congress return to Washington in the next week, that's one of the issues that they'll have on the table before them. They'll essentially have to try and reconcile all those 5 bills into something that they can present to President Obama for his signature. First myth, myth number 1, healthcare reform will lead to socialized medicine. No. Yes. Myth number 2, we can't afford healthcare reform with the recession and budget deficit. That's not true. A family share of the premiums for healthcare will essentially double between now and 2017 if we do nothing.
I'd like to bring your attention and ask you a question about the new figures that came out today with a $9 trillion deficit. How you might see the numbers change even to the heavier part with what's passed in Congress in this new bill. Thank you.
I think, you know what, you have to look at the overall cost of that, and with healthcare reform, without liability reform, it's going to cause a mass exodus of physicians. You're going to have a lot of issues, and they want to improve the quality. HMSA has been doing this quality stuff. They pay you for like getting a bone density when a patient has a fracture. If the primary care already got one, we don't get credited for it. It is such a mixed up, bureaucratic mess that you cannot rely on. And I can tell you that the physicians are just, there's just not enough of us, not enough specialists. And if you expect us to do care and get the tests, it's going to cost a lot of money. So if you don't do something about liability reform, you're going to have more tests than ever being ordered. And that deficit is going to be huge.
I agree with Linda. Enactment of H.R. 3200, according to the Congressional Budget Office, would increase the federal budget deficit by $239 billion. And this is only from 2010 to 2019, because the CBO only calculates how much a bill is going to cost within the next 10 years. So beyond that, you're going to see the costs go up exponentially. Like it actually, if you look at the report, it goes off the charts. It's going straight up. So that's going to happen. And Linda had a very good point about doctors, the cost to the doctors. Medicare, we have government health care. Government spending in healthcare accounts for about 43% of this $2.5 trillion sector. And Medicare and Medicaid reimburses doctors 20 to 25% less than private insurers. If we have complete government health care, we're going to see a lot more doctors not have any incentive to stay because they can't even afford to practice.
First of all, you're right, we have to get the Medicare fraud and abuse out. But why don't we just get the fraud and abuse out at $38 billion? Go and collect that, and then we'll discuss any other reforms. I have a different perspective on healthcare. I help set up hospitals in third world countries around the world. And if people have traveled, you have to know how wonderful our healthcare system is here in the United States. We also need from the doctors medical incentives that provide, like Duke University, it has been proven that if people sleep more, they get well more. There are programs to set that up, but our
20 years who is totally discouraged at the way he feels he must practice defensive medicine. I truly believe that we need to start with the liability, the tort reform, the across the state insurances, and dump the entire thing that is in Congress right now and start from scratch.
Here in Hawaii, we have the lowest number of orthopedic surgeons per capita of any place in the nation by far. And right now, we are already, I can't work more than 16 hours a day. I grew up on a farm working 16 hours a day, and that's good I have that farm experience, because let me tell you, I rely on it. The uninsured get seen. I mean, I see uninsured people every day almost. I see them in the emergency room, I see them in my office, I send no one to collections, and a lot of the uninsured are being seen, and maybe some other doctors are more aggressive about sending them to collections, but that's because some doctors are not even making enough to feed their kids. I had a doctor call me the other day who was not even making $40,000 a year. So, you know, she's working 80 hours a week and is not making $40,000 a year. That's really rough. So I think you're going to have, you are having, though the uninsured do have access to the emergency rooms, and most of us give of our time to see them and help them out. But I think it's a very important point to bring up.
This bill is an abomination, it's a power grab, and as far as I'm concerned, AARP has completely sold out to the Obama administration.
Spending for Medicare and Medicaid is unsustainable. The Congressional Budget Office Director has said so himself. We're going to be paying for this for generations and generations to come, so it's not fair to saddle future generations with this debt to pay for people who are currently 65 and older right now. So there definitely needs to be a restructuring of that system. Getting back to, what was the last thing that you just said? Oh, the tax. Yes, there is a tax if you don't comply, if employers don't comply with the mandate, if individuals don't have insurance. There is a tax which is counterintuitive because a large majority of people who don't have insurance can't afford it. And then on top of that, because they can't afford it, you're going to tax them. That's not a solution to the problem. So you're just going to see more wealth going away from people who have limited disposable income.